Good morning, everyone. Good morning, respected judges. I would like to present a paper on microbiological study of pus culture commonly found in acute CSOM patients in Tertiary hospital. This is the most common symptom found in our ENT OPDs that the patient come with the symptoms of ear discharge. This study aimed to identify the most common bacteriological flora in the chronic otitis media cases. Objective is to assess the management using the culture-sensitive antibacterial agents. Introduction. Chronic otitis media is persistent and recurrent middle ear cleft infection affecting the mucoperiosteal lining, leading to severe intra and extracranial problems. It is most prevalent in the developing countries due to the low socioeconomic standards, lack of health knowledge, and poor nutrition. The widespread use of antibiotics and poor patient follow-up have led to the persistent low-grade infection changes in the disease microbiology. Materials and methods. Study duration was from 1st January 2024 to 31st October 2024. Inclusion criteria. Patient with the active ear discharge for at least 3 months, clinically diagnosed with chronic otitis media. Exclusion criteria. Previous ear surgery, recent ear trauma, preceding otorrhea, presence of fungal growth on otoscope, and patients who have received a systemic or local treatment in the last 7 days. Detailed research plan. The detailed ear examination was performed using an otoendoscope. The discharge was taken for bacterial culture sensitivity under the aseptic precautions, and oral toileting was also done. Antibiotic sensitivity was done for bacterial elements by VTEC 2 compact methods accordance with the National Committee of Clinical Laboratory Standards criteria. Now, bacteriological sample collection. In accordance with the aseptic guidelines, ear discharge was collected. Ear discharge was collected using a sterile swab stick. Immediately, the sample was sent to the microbiological lab in a sterile culture tube, along with the request for gram staining, culture, and sensitivity testing. Age and gender distribution. So most commonly, the patients came to the OPD was found to be of mean age group of 31 to 40 years, while the least affecting groups were the children aged younger to 10 years and older above 70 years of age, representing total about 8% of total cases. The mean age participant was calculated to be 35 years, suggesting that the CSOM is predominantly affects the younger adults. It was most commonly found that the CSOM was initiated by either the acute episodes of acute pharyngitis or rhinitis, or with the ear infection of trauma, like using an earbud or ear sticks. Now, organisms isolated. The most commonly found organism was MRSA, methicillin-resistant Staphylococcus aureus, followed by Pseudomonas aerogenes, E. coli, Proteus myobilis, Klebsiella pneumoniae, Acetobacter, and Citrobacter. So, the gram-positive is only MRSA, and while others are all gram-negative bacteria. So, now the antibiotic resistance. The most common antibiotic resistance was found to be amoxiclav, followed by ciprofloxacin, levofloxacin, clindamycin, and then followed by trimethoprim, which was only found to be 13%. While the most common antibiotic sensitivity was found to be vancomycin, followed by meropenem, linezolid, gentamicin, piperacillin, and then followed by ceftriaxone. So these, we can see that the antibiotic resistance is most commonly seen in the oral antibiotics, which are usually prescribed by the doctors, or also many of our patients first visit either the local practitioner or they directly go to the pharmacy. And these are the antibiotics which have been abused by either the pharmacy or the local doctors without the knowledge of antibiotic resistance. So conclusion, CSOM is a significant cause of hearing loss worldwide, and it is extremely important to find the organism before starting any treatment. So the most prevalent organism found was MRSA. Most of the isolates were resistant to amoxiclav. The swabs from the middle ear for culture sensitivity is crucial for providing the information about the sensitivity of isolated bacteria to a particular antibiotic group and preventing the further bacterial resistance. So we have to understand that before prescribing any oral tablets, we have very limited oral antibiotics. Now, many of the cases we have seen that we have to admit the patient and we have to start the IV antibiotics to just stop the ear discharge and to make the ear dry, then go for an operative surgeries. It also offers the suggestions for the addition of medical care for the people who are multi-resistant to antibiotics. So these are my references. Thank you.
Okay, thank you. May I ask you, you mentioned about the age group which was commonly affected. You said children were less affected. And
Yes.
31 to 40 was
in my
a common
case.
age group. So what do you think? What is the reason for this? Why it is more common in that age group?
So, because many of these patients usually have the habit of using an ear stick or ear mopping for simple symptoms like ear itching, which is found in the ET tube dysfunction because of some simple grade 1 retraction. So, they have a more prominently or urge to use a ear stick. So, this causes a trauma followed by or also they have one episodes of pharyngitis or rhinitis which they don't go to a doctor or they don't take any proper treatment, and that leads to the middle ear infection, result in the perforation of the tympanic membrane.
Don't you think that this is a group which is exposed to the outside world more rather than children?
Yes, sir.
That can be okay. Second thing you mentioned about antibiotic resistant and antibiotic sensitivity. You rightly pointed out because of the overzealous use of antibiotics by pharmacy,
Yes, sir.
by MBBS doctors. They usually the patient when we get out tertiary center already he is resistant. So you mentioned about amoxicillin and all these things. Now it is almost very the figures are very high. So what do you feel the reason for this? Now ceftriaxone, there are high generation antibiotics.
Yes,
So
sir.
unfortunately you have to start with IV. So any other reason you think apart from the reasons you mentioned why they have changed the antimicrobial resistance, why it is changed now?
Because of the biofilm found in the middle ear. Now the bacteria are embedded in the extracellular substance. Then if we are suspecting the presence of biofilm, we should also suspect whether there is a squamosal CSOM type found in the middle ear. So maybe that.
Okay, thank you, sir. Okay, thank you.
Thank you,
Next.
sir.